Services physician, Dr. Alan Lazzara. Hey, Alan, welcome back.
Hey, Bart. How are you?
I'm good. Nice to see you.
Yeah, making me hungry. It's lunchtime.
Well, good news. We've got, you choose any of these fine items. We've got them in our green room today.
Oh, wonderful.
Yeah. So thanks for being with us, because I was at the hospital yesterday. I wasn't there as a patient. I was there for something else.
Mm-hmm.
But I noticed it's busy.
Yeah, it's a busy season. Every year it gets very busy between December and March. We know that it's quite predictable that people are going to be more ill with all the respiratory illnesses that come around. But you're right, you're paying attention. I've noticed too. I've been in the department and it's very busy.
It's like, I don't know these people.
Yeah.
But yeah, with all the hospital's full.
It is. Yeah. So we have. We have every ER, every hospital has limited space. I trained at University of Michigan, and they have limited space there too.
Mm-hmm.
We've tried to transfer patients there or other hospitals. Every hospital is busting at the seams, and so it's just kind of the nature, unfortunately, of this winter season. And also, it's been one of the worst flu seasons that we've had in the last 7 years. So I think. I was just listening to a report from the CDC the other day that it's the most number of flu cases in the last 7 years. And it's finally reached an inflection point. They think that the cases are not rising as sharply. They're starting to maybe taper off, hopefully. But that's predominantly what we're seeing. And we only have tests for 3 of them. So we have the flu, COVID, and RSV. Those are the only 3 viral tests that we really test for these upper respiratory tract infections. So there's a variety of other ones that come through, and they're all very similar. People get told they have bronchitis or a viral upper respiratory tract infection, the flu, COVID.
Strep throat?
Strep throat is different, but all these, they're all essentially colds on a spectrum, from you just need to be in bed with some chicken soup to somebody can be very, very ill with it. And people feel horrible. We've all had the flu, and I think we kind of got a little bit of a grace period from the flu because COVID dominated for a while, and now the flu's back and showing us who's boss.
Because we were practicing the health, distancing, the masks, we weren't getting the flu.
Yeah, some of that. I think a lot of that, those protocols that we engaged in, probably not the staying away from people from 6 feet. I don't know why it wasn't 4 feet or 5 feet, but it was. I think wearing the masks and hand hygiene and emphasis on that really, and then also people were staying away from each other, which nobody liked, and I think that really curbed the respiratory infectious disease. But a lot of that stuff still applies. Hand hygiene and sneezing into your elbow, not in your hands. But nobody wants to be isolated during the wintertime, and it just happens. The flu has been around for millennia. We've evolved with the flu, and the flu evolves with us, and it's going to come back every year. So,
but we have a vaccine.
Yeah, it's not too late to get vaccinated. So I see a lot of people. We see a lot of people in the ED for they feel terrible. They got a fever, they got a cough. They just feel like their body's aching all over, and most people that I'm seeing who are having a really rough time with the flu are not vaccinated. And so people often say, well, I don't get vaccinated because every time I get the vaccine, I feel sick afterwards. Or I still get the flu even though I got vaccinated. And so those things are true, because what happens is your immune system, when it sees some of that beat up dead flu virus, has an immune response. So you get some inflammation, you build some antibodies, and so you're going to feel like stink for maybe 24 hours. But the benefit of that is that we see people who do get the flu vaccine have much shorter courses of illness, and especially people who are immunocompromised, those people who smoke or have, weight issues or cancer and stuff like that, they have much less morbidity when they're vaccinated, which is great. I went to medical school in the 2006, 2010, and it was during I forget the name of the flu that was happening then, but we were seeing predominantly, the really bad cases were happening with younger patients. And so I remember seeing 19-year-olds, 25-year-olds on ventilators. It was really scary. We haven't seen that kind of flu in a long time, but I don't want to scare anybody, but the flu is going to happen every year, and there's some people, unfortunately, that are going to get really, really sick from it. And I encourage everybody, mainly because I don't want to be sick for 10 days. I'd rather be sick for 3.
Really, the flu can last 10 days?
Yeah, the average course of a viral illness like that is like where the real bad symptoms are usually it's like 1 to 5 days.
Oh, man.
People who aren't vaccinated tend to have a little bit longer. But the thing that I think people don't know is that everybody says, well, you're going to be done with this cough in a week. But we know from studies with kids and other studies that people who have a cough, the average time is about 14 to 17 days. So you're going to cough for 2-3 weeks. And so we see that people coming in for the cough, and it's expected, it's unfortunate, and it's got the best treatment though. It's a teaspoon of honey every couple hours. It will help with your cough. So
we also are seeing that there are deaths due to the flu, and in this country, 16,000 people this year have died from the flu.
Yep,
that's pretty scary.
Yeah, I think infectious disease is a scary thing. It's very unfortunate that anybody could succumb to something that we just roll through, and it's like a really bad cold. But there are some people who either have genetic problems or they have other medical issues that make the flu more potent in them in their particular case. But it's an expected thing, and it's very unfortunate. And we don't really have great treatments for the flu. It's mainly supportive care. A lot of these viruses, they don't respond to the antivirals like bacterial infections respond to antibiotics. Antiviral medications are not as effective, and so we really rely on respiratory support and breathing treatments and things like that help our older or very young or immunocompromised patients get through the illness. But really, at the end of the day, it's your body that's beating the infection. It's not the antivirals, and it takes time. So,
next week, roughly, is the 5-year anniversary of the COVID pandemic.
Yeah.
So I was curious, as an ER doc, are there things that we learned through the pandemic that I guess might be the silver lining from the experience? Obviously, we're still seeing COVID cases, but has medicine or practice treatment in the ER changed as a result of how we reacted to COVID?
I think I think across the board, like reflecting on that, we both in medicine and from a societal component, we learned a lot of stuff. Like people, I think, started to enjoy the outdoors more. I think people started to appreciate, being at home more, working from home more. But the kind of reset that is occurring now is a little jarring. I know people that work predominantly from home, and now they're going back into the office, and it's this rebalancing. And same with medical treatment in the emergency setting. We don't have. But before it used to be somebody came in with chest pain, and during COVID that's probably COVID causing their chest pain. Somebody came in with body aches, it's COVID. Somebody comes in with a number of other symptoms, it was COVID. COVID was the answer for a lot of things, and now it's not. It's like COVID diet, and so we don't see as much morbidity, mortality from it, but we still have learned how to handle a surge process from that. So we used to use the tents out in the parking lot. Now we have expanded our treatment areas to include, places in the lobby where we can take people out and then talk to them, and then bring them back out to the lobby. And I know that many of our patients, when I interact with them, I often apologize and say, "I'm sorry, you don't have a room," and by and large, they say, "It's fine. We see you're so busy, and we just appreciate being seen." And that, I think, is one of the differences of our site at Henry Ford and Jackson and some of the other IEP sites that we staff, is that we make a strong effort to get the physicians out into the lobby to find that needle in the haystack, because we'll find somebody who's sitting there and has a very unique presentation of a stroke or a heart attack or something like that is hidden, and that's our job as ER doctors, is to find that needle in the haystack. And so I think from COVID, our ability to move out into the fray and the forefront and find those patients out there and be able to handle that surge has improved, and I think we've kind of gotten used to it. We call it lobby medicine, and nobody wants to do it. Patients don't want to do it. Nurses don't want to do it. I don't want to do it. But it's something that we are committed to do because we are able to move people's care without having them sit there for 8 hours getting nothing done.
Well, I think people appreciate it. Sitting in the waiting room at the ER, if you see a doctor walking around looking people over, I think that's what we want to see.
For sure. And I agree. If I was a patient, I would appreciate that. And I think it's also very apparent that I can promise you we're not just having coffee in the back. We're trying to push things through. But it's like any system that's overwhelmed, it's hard to deal with. There's resource issues. There's things that we're constantly, our leadership is constantly dealing with, trying to move things forward. And it is just, a system can be overwhelmed by, if there was a bus, rollover on 94, we would be, inundated with patients, and we would find a way to deal with it. But that surge medicine is, I think, part of the future, unfortunately, because the needs for immediate care and emergency care are not getting smaller. People have a hard time getting into their primary care doctors. We hear that all the time. People have, they have elderly parents, and our population is aging with the silver wave of older patients that are coming through. So we know that it stinks, but we're committed to giving everybody the best care we possibly can. And when you're in the lobby, things are still moving. Your labs are still running. Your CAT scans are still going. I love seeing our radiation technicians go out there and grab our patients to get their scans done, because if I could just snap my fingers and have all those tests done, then I can tell you what we can do right then and there.
Yeah.
But it takes time, and we appreciate everybody's patience, and we're working hard on it and trying to figure it out.
I'm amazed. I've had some labs and blood work and x-rays and things in the last few weeks, and in some cases, and I'm not exaggerating, I get home and the results are in my chart.
Yeah, it's pretty incredible. When sometimes we'll see patients and they'll say, I don't want to stay in the hospital. I don't want to be in the observation unit, or I don't want to do this. And I often say, we're going to be able, because of the amount of resources that we command in that setting, we're going to be able to get probably 2 weeks worth of work done in a day. Because you don't have to schedule the appointment. You don't have to go here, go there, wait for the radiologist, et cetera. We can get all that stuff done so quickly, and I think it's pretty amazing. But yeah, nobody likes to wait, but we're doing our best for sure.
Well, I appreciate the great service you and everyone on your team at IEP and Henry Ford provide the community. I think it's pretty awesome.
It's our privilege, really. We all went into this for taking care of patients, and that's what we're doing.
I understand you're moving out to the country so you can do rabbit hunting in your backyard.
That's the goal. Yeah, we're moving out of Ann Arbor and moving to the country. So we're excited to move closer this direction, and we're excited to see more trees in our backyard. So it's a good place to live.
More trees, more squirrels.
Trees. Yeah.
All right, good to see you. Thanks for coming in today.
Yeah, thank you for having me. Anytime.
You bet. From Henry Ford Jackson Hospital Emergency Services physician, Dr. Alan Lazzara.